Hi, my name is Christopher Lam. I'm a registered massage therapist and personal trainer practicing out of Vaughan, Ontario, out of my business High Performance Rehab. You're going to be seeing videos from me that focus on athletic rehabilitation, exercise progressions, and all things to do with sports and exercise. You can follow me on LinkedIn at Christopher Lam, Christopher with a K and an F, and on Instagram at High Performance Courses. So today we're going to be talking about some foundational movement patterns, things that really anyone should be able to do and everyone should be able to do in order to sort of just move optimally. These are motions that you go through in your everyday life without maybe even necessarily thinking about it, that if we look back to the root cause of a lot of injuries, it comes back to a lack of ability to perform one of what I call 6 foundational movements. So depending on who you ask, you might hear more or less, but I usually consider these to be the 6 sort of foundational movements. So we'll start with the squat. So squatting position, pretty easy one to think about, whether you're sitting down, whether you're going to sit on a toilet, anything that you're doing that's really going to require the sitting motion, you need to be able to squat. That's essentially what the motion is. So you might think to yourself, well, I'm not able to do a squat. I've got a hip issue. I've got a knee issue. My ankles are too stiff. So there's a couple different ways that we can regress this, and you can make it as difficult as you like to, obviously, by adding weight. So one of the ways to regress it is to do a box squat, so to have something behind you. So in this case, this is actually a fairly low box squat, so this might be a little bit further along the progression for you if you've truly got some serious issues going on at your hips or knee. But essentially in a box squat, you're going to have your feet slightly angled out. You're going to have a nice tall chest. You're going to sit back. You're going to touch down lightly. You're going to come back up. So the idea is you're not sitting down and slouching and letting your body fall into a full seated position. You're kind of maintaining that upright position and you're coming right back up. So you can make this easier by having a higher box to go down onto. So you might only be doing a motion like this, and that's where you might start if you have some more acute issues going on. Or as you start to progress it, you might take the box away and might just go into a full squat, or hold a kettlebell or dumbbell in front of you and do a goblet squat, or back load it and do a back squat. But those are some ways that we can get into doing some squatting motions. The next movement pattern we're going to be discussing is the lunge. So lunges are a foundational pattern for anything where you're going to be off balance, where you're going to have one foot separate from the other. So when you're walking, whether it's on a flat surface or up and down stairs, you're mimicking a lunging pattern. So it's something that everyone should be able to do to make sure that they have healthy joints as they're going through the daily movements of their life. So we'll start by talking about foot positioning. So when you're doing your positioning for your feet, I don't want to give you arbitrary numbers, certain distances, and it's not universal to everybody. So what you want to focus on in terms of the separation of your feet horizontally is focusing on having your feet on separate train tracks, not the same. So to have your feet on the same train track would be to have them one foot in front of the other like this. Just an awkward motion. You're going to have really poor balance. So you want to separate them a little bit, both pointing forward, but on separate train tracks. The next thing is the distance between your front and your back foot. So you don't want your feet to be so close that your front heel is coming up and you're putting too much pressure onto your toes and your knee. You also don't want to be so far back that you're really reaching forward that you're losing your neutral spine to get into that lunging position. So you want to try to find sort of the healthy medium. So when you come down into your lunging position, you have a neutral spine and your heel is able to stay on the ground. Perfectly fine for your knees to go over your toes. In fact, I encourage it for good knee health. So a way to regress this, as you can see, I'm using a dowel. So I can go at varying depths depending on my capacity to do a lunging pattern. So maybe I'll start off with going down just 50% of the way and using the dowel as much as I need to help to support my balance. As it starts to get a little bit easier, you can still use the dowel, but come into a deeper lunge. Maybe you progress to a point eventually where you don't need the dowel anymore. So you can drop it all together and you can just do your lunges body weight. So you can use your opposite arm as sort of a counterbalance. And then obviously you can progress it by getting into using weights as well. So that would be the lunging pattern. Next, we can talk about the hinge pattern. This is one where people really find you're getting a lot of like lower back pain, a lot of pain into sort of like your SI joints, your lumbar spine, even a lot of tight hamstrings. People really typically have lost their ability to hinge. It's not something that they really focus on. They compensate in a lot of ways to be able to do the pattern, but their ability to actually do it in a way that's healthy for your spine and for your hips is usually kind of lacking. So a hinge is essentially how well can I disassociate my upper body from my lower body. So you have kind of this access point right at your sacrum, your SI joint, where a lot of weight shifts from your upper body to your lower body and vice versa. So that's why people tend to have that pain kind of right at that like L4, L5, SI joint region. They've lost their ability to hinge. So how I like to teach people to do this is something called the 3-point hip hinge. So you take a dowel, you can use a broomstick, anything that kind of is straight and firm, and you're gonna put it behind your back in this manner. So the 3 points of contact are the back of your head, the middle of your spine, and your tailbone. So what you're gonna do from here is you're gonna get your feet pointing forward, just about shoulder width apart, slight bend from the hips, and you're gonna push back from your hips without bending your knees any further than you initially had them. And you're gonna feel a stretch in your hamstring, and you're gonna come back up. So the idea here is all 3 points of those contacts need to stay in contact all the way through your range of motion. So typically what you'll see with people, maybe they'll lose their T-spine like that, or maybe they'll lose their tailbone like that, or maybe their head is coming off like that. And that's very indicative of someone who is not able to do a hinging pattern properly. Often very explanatory of a lot of back pain, a lot of hip pain, even a lot of neck pain from their inability to control their spine. So you practice that, 10, 15 reps, multiple sets, multiple times a day even, before you warm up for exercise, or even if you're just doing it as a part of a therapeutic exercise program. You want to get this hip hinge pattern with the dowel down perfect before you move on to anything else. Once you can do that perfectly fine, then you can start to get into things like deadlifts. So you can hold, the dowel in front of you, and you can do it without that support, keeping the dowel close to your body and mimicking a deadlift pattern. You can then obviously start to add weight to the movement. But the problem is that a lot of people find with this hinging pattern is you'll see a lot of people deadlifting in the gym. They'll have weight on the bar. You ask them to do this position here, and they can't do that without any weight on the bar. So they're coming into you and they've got, again, SI joint pain, they've got lumbar spine pain. Oftentimes this is the reason why.